My name is Gerald Jaideep. I'm the CEO of Medvarsity, what is possibly India's only online education entity in the healthcare segment, right? You do have other players in the technology, digital marketing, and other entities. Interestingly, Medvarsity as an online entity was started almost 16, 17 years ago, much before modern broadband as we know existed. Our chairman, Dr. Pratap Reddy, saw the need to impact healthcare through improved quality of education and therefore democratize it by using technology as a means. So that's where I come in today, and we at Medvarsity try and impact the quality of education in India for the healthcare segment. So, okay, this is working. So that's a quick snapshot. I won't take time on this. So one of the interesting things, I spent yesterday at the IPSC conference, and today, since this morning, I've been at this conference. What I noticed is we have an exceptionally talented set of panelists, even right now, and also a very exceptional set of audience. Some of the questions that were being asked today were truly very impressive. So given that a lot of you come with very deep experience and knowledge in your respective domains, all I wanted to state is that I have very little skills. And I'm going to borrow from what Albert Einstein said and just state that the reason why I'm here on stage and the reason I'm going to talk about augmented reality and technology impacting education is because I'm insanely curious and apply the curiosity to achieve certain goals. And when we looked at the same concept from an education perspective at Medvarsity, keep in mind Medvarsity is an informal education entity. I've spent the last 22 years in informal education ecosystem. Formal education is what you would go through in schools and colleges and formal educational institutions where you have scheduled hours, you have timetable, you get in, you have lab, you have infrastructure, everything working. We deal with technology. We teach people on these devices. We teach people in highly distracted environments. And whether it's medical learning or any other kind of learning that happens on portable devices, mobile devices, online, digital learning, you have to realize that unless the inherent curiosity to learn isn't built into the learner, their ability to benefit from that learner is going to be limited. Right? So we at Medvarsity, we've used this insight over the last couple of years to change and enhance our courses so that we can increase the value of what we're doing. So quick question here. Does anybody know what this is for? Polio, right? So the Pulse Polio program in India. So in 1979, India had the highest incidence of polio in the world, right? And a lot of experts, global experts, healthcare experts, believed that eradication of polio in India, in a country like India, was virtually impossible. Given the low sanitation and hygiene standards, given the size of population, given the limited reach in terms of the government-led healthcare, everybody thought it's not going to happen, right? But as of 2014, we are officially polio-free. And a large portion of that, while it was driven through policy change, through healthcare entities working in this segment, through organizations like the Rotary and other organizations taking up the mandate of impacting polio, another critical aspect of eradicating polio was through education. Every one of us in this room is familiar with this phrase, right? All of our film stars, from Amitabh Bachchan to Dharmender to Ranbir Kapoor, have done ads about Do Bund Zindagi Ki, right? And that constant education actually led to a change and impact that all of us are now today proud of. So for us, so for us, what is critical from an education perspective is that when curiosity exists, and you're able to drive that curiosity into an action, that is what education essentially means. And I'm borrowing from Sir Ken Robinson here. All of us talk about formal education, but formal education without that inherent curiosity built in, and that curiosity translating into a measurable action. So when I say polio and therefore eradication of polio through education, the measurable action was polio doesn't exist in India today, right? So let me give you another example of how curiosity and education works together. How many of you have heard of the Hole in the Wall project? All right, great. So some people have heard of this, right? So in 1999, Dr. Saugata Mitra, that's him right there, he was part of NIT. So NIT is head office at that point of time was in Kalkaji in Delhi, and Kalkaji is surrounded by slums on two sides, and there are a couple of corporate offices, right? So what Dr. Saugata Mitra did was, in one of the holes that was on the wall of the building, he actually sunk a computer into the wall, put a simple, trackball on the wall next to it, and left it unattended without any instructions or any details on how to use the system. Within a few hours, the slum children from the slum rushed up to the computers, they started playing around with it. Within a few days, they had figured out how to use the basic function of a mouse and the screen. There were certain programs loaded onto the system already, and it was connected to the internet. Within 5 or 6 months, Dr. Saugata observed that the kids had learned to use the computer. They'd also learned how to download new programs from the internet, and they had also figured out how to teach other children in the slum how to use that system, right? So how did that happen? Fundamentally, it happened through curiosity, which brought the audience to the device. But the second part was collaboration, where one kid in the slum who might have seen the computer being used in the hotel that he was working in as a cleaner would show that off to the rest of the kids around him, right? So knowledge was being transferred from one person to another person organically. So expertise kept shifting. Now, when one set of kids went to school or to work, the other set of kids would play, and through the journey of discovery, discover new features, new functionality, and in the evening would teach that to the rest of the kids, right? So Dr. Saugata did this in 3 states, Delhi, of course, then in Madhya Pradesh and in Uttar Pradesh, and he discovered that consistently, curiosity and collaboration led to very intuitive learning. Hole in the Wall is a very celebrated project. Dr. Saugata Mitra also spoke at TED Talk, and today has defined a lot of learning methodologies on how to teach and how to drive ecosystem changes. We've built intelligent platforms, we've built social learning, we've built e-learning content, we've built two-way dynamic engagement models like virtual classes. We do a lot of fun stuff at work. We build in technology. But these are technologies that each of you would be familiar with: mobile learning, e-learning, social learning, terminologies and buzzwords that you're all familiar with. We recently also tied up with another company called Vahan, where we're bringing learning onto WhatsApp-based solutions. So you could actually sit on WhatsApp through an AI algorithm, learn for field stuff, right? But that still has a limitation, because what we're doing is we're bringing digital learning to an audience where the context might not exist. So let me share a context where we're now starting to look at augmented reality to actually start impacting learning. So that's my daughter's hand. During this Diwali, she had an argument with a dog, and that was the consequence, right? So we rushed her to a neighboring clinic where first aid was provided, and then this happened in Bangalore, and we moved back to Hyderabad, and within a few days, infection set in, and things became so worse that she had to get admitted, she had to go through surgery, and 2 weeks of physiotherapy for her to recover the use of her hand back again. And what we realized was the biggest reason for that infection and hospitalization and surgery and everything else was that at the primary healthcare center where we went after the dog bite, they did not wash her hand properly as per the WHO protocol, right? Now, this is something that at every healthcare facility, every nurse, every doctor, every healthcare worker gets trained how to do when they join that place. So if training happened, but a patient walked in and it wasn't done properly, where did the training process fail, right? So when we started looking at this problem, so we said, how can we bring now contextual learning to that ecosystem? How can we make sure that while a student learns something in a classroom, through, say, for example, our own masterclass in infection prevention and control, when they go through that class, and when they walk out of that class, when they walk back into the workplace, the hospital, the clinic, the healthcare delivery point, how will they know that they have to apply what they've learned? So I'll take a quick pause here, and I'll need somebody to click on that screen to play the video, but just don't click it now. Don't click it now, and I'll tell you why I'm going to not click it now. What I originally wanted to do was actually bring our AR prototype on stage and reveal it. We were launching it today, and we wanted to show it to you guys, right? This is and I'll play the video. The video was essentially a backup, and thank God that backup happened. We made 3 prototypes. 2 of them broke on shipping. So Murphy was truly our friend over this weekend. Yesterday was the launch at IPSC, didn't happen. We had broken pieces of glass lying everywhere, and today I'm going to show the video to you, right? So can you just click on the content area so that the video plays? So this essentially is a smart mirror which senses a person when they approach it, and it is a non-touch device, so essentially you're not allowed to interact with it. It's a low-cost device. It's built on a Raspberry Pi IoT framework, and can be integrated into every hospital. The cost of the eventual device is going to be less than 25,000 rupees. Our intent is to integrate it in every hospital, every patient treatment area, every OT segment. So keep in mind, it's teaching fundamental skills on what you need to do when you need to wash your hand before touching a patient. What do you need to do when you need to go through the scrub process prior to surgery? And the focus is only the action that you need to do, not the person behind it. And because you watch your reflection when you're doing it, you can just follow the actions that it's executing on. So the intent is by using low-cost technology, by using augmented reality tools. Augmented reality, I'm sorry, but those of you who thought I'm going to wear a HoloLens here and do some fun stuff, it's not augmented reality. Augmented reality is blending something digital on top of a real world, right? So this is our version of augmented reality. So what we're hoping to do is, through this process, increase the quality of healthcare being provided at the last mile. Thank you so much.